morning, good afternoon, and good evening, everybody. Welcome to another week of the Global Cafe. My name is Elizabeth Lewis, and I am a Senior Policy and Project Coordinator here at the IFA. I am very excited to be introducing you all to Dr. David Conn. Dr. David Conn is a professor in the Department of Psychiatry, the University of Toronto, and a geriatric psychiatrist at Baycrest. Until recently, he served as the Executive Vice President of Education and Chief Academic Officer at Baycrest Academy for Research and Education. David is founding co-chair of the Canadian Coalition for Seniors' Mental Health and past president of the Canadian Academy of Geriatric Psychiatry. He's the author and co-author of over 100 publications and is the co-editor of 3 textbooks, including Practical Psychiatry in the Long-Term Care Home, a handbook for staff. He has received numerous awards, including the Canadian Academy of Geriatric Psychiatry Award for outstanding contributions to geriatric psychiatry in Canada, and a Distinguished Service Award from the International Psychogeric Association. As you can tell, Dr. Conn has accomplished so much in his career, and we are very excited to have him join here today to discuss social isolation and loneliness amongst older adults. So welcome, Dr. Conn.
Thanks, Elizabeth. Hello, everyone. It's great to see you all and have this connection around the world. Fantastic. Love to know where you're from. If you want to put in the chat which country you're from, that would be kind of fun to see.
Thanks, Dr. Conn. So we'll just go ahead and get started, and we'll see if anyone inputs anything in the chat. We'll keep our eyes open. But before we speak about social isolation and loneliness amongst older adults, I want to ask a bit more about yourself. So let's start with asking, what ignited your passion in this field, and how did you get started?
Oh, that's a great question. I like that. So, um, well, just to note, so originally I grew up in Ireland, in Dublin, Ireland, and moved to Canada in my 20s after medical school. In medical school, it was a very traditional medical school, excellent one called Trinity College Dublin, but we weren't actually exposed to an awful lot of psychiatry in that program. It wasn't really highlighted as a key area. And so when I came for my I came to Toronto after medical school. Your first year is usually a rotating year where you go through different areas and specialties. My very last rotation was in psychiatry. And I'd already decided to be an internist, internal medicine, right? But my last rotation was fascinating. I just love psychiatry. I love the working with people who are struggling with mental health problems, and it just seemed to me to be a lot more interesting than kind of regular internal medicine. So I switched programs, went into psychiatry, and then later on I started training in an area called consultation liaison psychiatry, which is basically um, helping people, working with people who have both physical issues and mental health problems, the two together. So usually people in hospital. So that became my focus. And then that evolved. If you think about who's in hospital, it's mostly older people, actually, by and large. So that kind of evolved into geriatric psychiatry. And after doing some training in Boston, I was recruited to Baycrest, which is a big geriatric center in Toronto. And yeah, that's how I got into it.
Wonderful. Definitely a world traveler there, and very interesting to hear how you got involved. So thank you for that. Although our audience members have likely heard of, experienced, or known somebody who has experienced social isolation and loneliness, could you help set the stage for us all by explaining what these two terms mean and what makes them different?
Yeah. Um, we tend to talk about them together. They sort of run in. Social isolation and loneliness. You'll see that all the time as though it's a sort of single thing and one must lead to the other and so on. And in fact, they really are two separate concepts. So, so social isolation is objective. So it's basically, you could measure it easily. So how many contacts do you have every week with friends or family? You could measure that. And for how long? And then you could start looking at other things like the quality of the interactions. But it's highly objective. So whereas loneliness is completely subjective. In other words, it's a it's an unpleasant, generally a sad or unpleasant feeling. It's a feeling that people have. They feel alone or disconnected. They don't have enough connection to other people. And that often relates to the kind of quality of the connection as well with other people. And it doesn't necessarily occur only when a person is socially isolated. So, for example, you can have a person who has quite a lot of social contacts. They see people quite a bit. Maybe they see family quite a bit. But if you actually ask them, they'll tell you they feel lonely. They don't feel a strong connection to other people. They feel like something's missing. And for some people, that could be a lifelong thing. They've always felt a bit lonely. Um, and obviously, if you are socially isolated, you are more likely to feel lonely, but it doesn't necessarily go together. There's another concept too that's worth noting that's been called existential loneliness. Oh, that's the sort of fancy philosophers who'll tell you that, we're born alone and we die alone and we're this tiny speck in a gigantic universe and they feel disconnected from it all, But that's a sort of sidebar. So,
Thank you for that.
yeah.
And as you've explained that socialization sounds to be a bit more objective, while loneliness is more subjective, could you speak, I guess, a bit more to how those two are measured and researched, and maybe also what their rates look like in the Canadian context?
Yeah, absolutely. So let's think about how it's measured. And actually, it's worth making. I love a quote. This comes from way back in the 1950s. There was a German-American psychiatrist. Her name was Frieda Fromm-Reichmann, a well-known and respected psychiatrist. And she wrote about loneliness at the time. And one of the things she said was that from her investigations, loneliness was actually tended to be minimized or ignored by psychiatrists and mental health professionals. And for some reason, it was barely mentioned in most psychiatric textbooks at the time. And she said one of her theories was that loneliness is such a painful and unpleasant experience that everyone does everything they can to avoid it, even avoid talking about it. So, um, which was kind of interesting. And then I sort of reflected on that. In psychiatry, uh, we have a kind of diagnostic Bible. In North America, it's called the DSM-5, the Diagnostic and Statistical Manual of Psychiatry, of mental disorders, right? And there's the International Classification of Diseases. But in the DSM-5, which is over 1,000 pages long, it's a huge book, okay? It's got every single mental health diagnosis you could come through, right? So in the 1,000 pages plus of that document, loneliness is only mentioned once, okay? And whereas something like depression would be mentioned all over the place, So I think the Dr. From Reichman had something. She was right. I think we've tended to ignore it. Not so much anymore. It's now being recognized as a key problem. The question you asked about how do we measure it is interesting. Um, there are different tools and scales for measuring. Some are long and have lots of questions, and some are brief and short, which are better in clinical practice. So, for example, for loneliness, there's something called the UCLA loneliness scale, which started out as quite a long scale and then was reduced to just 3 questions. Okay, and you can actually score a person's loneliness using this particular
Wow,
scale.
that's
Um,
interesting.
the interesting thing about the UCLA loneliness scale, it doesn't actually use the word lonely in it. It doesn't actually ask people if they're lonely. It's more about, the connections that people have, which is, again, really interesting.
Yeah.
Um, and then for social isolation, there are a number of different scales. There's one called the Lubin scale, which basically asks about the frequency of your contacts with friends and relatives, and then you can come up with a score.
Mm,
So those are some of the tools that we use to measure whether people are lonely or not, or isolated or not.
yeah. Thank you. And in terms, I guess, of the Canadian context, do you have any insight on, do we have a general sense of what the rates of those two experiences are like here?
We do actually. We have a group here called the National Institute on Aging of that's Canadian, not the American, but they've done a recent survey, national survey. Um, and they came out with numbers like about 40% would
Mm,
be socially isolated. This is of adults of over the age of 50. And and then when it comes to loneliness, it was up at around 58%,
wow.
but reported some degree of loneliness. But if you look at people who said they were very lonely, that's around 18%,
Okay.
which may be more. I mean that, I think that's probably the most significant figure. But yes, but about more than half of people will tell you they're lonely at times. So
Mm,
yeah.
okay, that's very interesting. And I guess what are sort of the telltale signs of that somebody is experiencing loneliness, and what are the impacts of social isolation and loneliness on those who experience it?
Yeah. So when we think about it, we're probably thinking about, mental health problems associated with loneliness and isolation. It's the first thing that comes to mind. I think we sort of
Okay.
see it as, I mean, it's been seen in the past as primarily a social issue.
Mm,
Now we think about it as a health issue, social and health issue. Um, and one of the reasons that there's been a spotlight on this problem globally is a lot of research that's been done looking at the outcomes of people who report social isolation and loneliness versus people who don't. And it turns out, rather shockingly, that people who are lonely or isolated or both have much worse health outcomes.
mm,
So it's associated with very high rates of physical illness, so cardiac disease, cancer, um, dementia,
mm,
and even a much higher rate of death, a higher mortality rate. It's been likened to the equivalent of smoking 15 cigarettes a day in terms of a risk factor for poor health outcomes. And then, of course, it's also associated with depression and anxiety and even death by suicide. So the outcomes, both mental health and physical outcomes, are significant. They're so significant that that we feel like we need to do something about it and help
okay.
people um, become less lonely and less isolated. So it's become much more of a sort of social and health issue now that we need
Okay.
to work on together.
Absolutely.
Yeah.
Absolutely. And I see some engagement going on in the chat here, so I do want to address that. We have a question coming in from one of our cafe regulars named Shmuel, who asks, how how community support can effectively reduce social isolation and loneliness amongst older populations?
Mm. So can you just read that again? It's how can,
Yes, how can community support effectively reduce social isolation and loneliness?
yeah. So ultimately, it is all about community, and it is all about um, each community and society paying attention to this and trying to support individuals who may be isolated and lonely. We
Mm,
can talk about this quite a bit as the discussion goes on because we. So I think we're gonna talk about guidelines soon, right?
yes.
Yeah. Okay. So to mention to the group that here in Canada, working with the Canadian Coalition for Seniors Mental Health, which I've been co-chairing that now for more than 20 years. So it's a national coalition of individuals and organizations who care about older adults and their mental health. And it's
Okay.
very interprofessional, interdisciplinary. It's associated with our National Academy for Geriatric Psychiatry, but it's interprofessional. So we spent a couple of years recently creating clinical guidelines for social isolation and loneliness among older adults. And that, what does that mean? It means we've created a document that helps health professionals, social service providers to help their clients and patients with this particular issue. And so we can tell you about that in a minute, but there are
Mhm.
all sorts of interventions that are possible, both by health professionals, but more
Mhm.
so by the community. So in, response to that particular question, there's a lot we can actually do to help people set goals for themselves and to maximize opportunities for them to be connected. So it's actually a complex question because it depends on the individual and why are they socially isolated and lonely.
Okay.
Turns out there's a lot of different reasons why somebody could be lonely and isolated. So to help an individual, we need to understand that person.
Mhm.
Another thing that's worth mentioning, I think, is that, so one of the things in our guidelines is we say, this is not a one size fits all. You might say in another condition, let's take high blood pressure, well, you should
Mhm.
always start with this medication and then go to the next medication.
Right.
It's not like that. You have to understand why the person's having this problem in the first place. And then when you understand what the problem is, you can figure out what the solutions might be.
Mhm.
I think, I think as a society, though, and the Surgeon General of the United States, his name is Vivek Murthy, he came out with a document last year, basically calling this a public health emergency. And he
Wow.
highlighted this as a serious health issue. And one of the things he said is that our generation is the most connected generation in the history of mankind because of what we're doing right now. We are very
Yeah.
connected. We're
Yeah.
using our cell phones and our Zoom and whatever it is, and we're hugely connected. Um, but in spite of this, the rates of loneliness have doubled since the 1980s. So,
Mm.
people might say, well, I have, 200 friends on Facebook or whatever social
Sure.
media we're talking about, but people actually are increasingly lonely,
Mhm.
So, um, so he has said that, as a society, we have to be better connected and not just electronically, but in
Mhm.
person. And that's a whole other discussion we might have with the group, but how connected do we feel right now? I mean, I feel somewhat connected to you all. It's great. I mean, if it wasn't for Zoom or the equivalent, there's no way we could have a meeting like this from around the world, right? It's actually marvelous. Um,
Mhm.
and most of us, many of us who are now working in situations where instead of having meetings in person or conferences even in person, we're doing it like this, right? And
Right.
it's actually not the same. There's a lot of evidence now that if you're in the same room with someone, there's a much deeper connection that happens for
Mhm.
various reasons. So I think that's one thing we should consider. What's the right balance in terms of electronic connection as a society, as we become
Right.
more and more kind of isolated in our own little cubbies, but
Mhm.
electronically connected. So, we could
Yeah.
argue, some people could say, actually, I do feel way more connected because I have things like Zoom. So I know it's really interesting. But there are so many ways that people in communities can connect with each other. There are senior centers, there's religious organizations, so churches and mosques and synagogues where people can come together. Um, but the thing is that people who feel disconnected and lonely may be less likely to
Mm.
join others for a variety of reasons. And so for some people, we have to understand their psychology. We have to understand them as a person and figure out, is it something to do with self-esteem, for example? Some people just don't feel good about themselves. That might be a long-standing issue, right? And they feel, oh, no one would want to spend time with me because I'm not interesting. Um, that person can be helped actually with some counseling or therapy, something called CBT, cognitive behavior therapy. So, one of the many interventions that we recommend in the guidelines is for some people, talk therapy can actually be helpful and encourage them then to become more active or engaged.
Right.
There's another very interesting development in this area, which is called social prescribing. I don't know if
Mhm.
any of you have heard of social prescribing. You know how a physician gets out a prescription pad and writes you a prescription, usually
Yeah.
for a drug, right? So,
Yeah.
but social prescribing is where, and there's different elements of social prescribing. At its most basic, your healthcare provider would actually take a prescription pad and tell you that they want you to, call a friend 3 times a week, or go to the local community center for
Sure.
seniors twice a week. That was sort of very early stage of social prescribing, but it then developed into a much larger field where some countries have started to develop programs where people are actually trained and hired to be system navigators or link workers, and their whole job is to actually help people to connect to their communities. So, so say a busy family doctor, it tells his or her patient, I would like you to get more connected with the community, but I don't have time to tell you how to do that. But what I'm going to do is refer you to Jane, who's just this lovely link worker, and she'll work with you to figure out what would be a good activity or connection for you in this community. And
Okay.
she knows all of the resources and opportunities that are available. And so there are now social prescribing programs in many countries that
It's very
actually
interesting.
bridge that gap, and it's much more effective than just being told, oh, you should go to the local community center.
Yeah.
Yeah.
Absolutely. No, that's very, very fascinating. And I can tell we have a lot of folks who are interested in this conversation as well. We have a lot of activity in the chat. So I'm going to pop in some questions before I lose them. We have Isaac who is here asking some questions about technology again. If you are here, Isaac, and want to read your question or ask it directly, please do raise your hand. Otherwise, I will go ahead and read it. But Isaac is asking, hello, in what ways? Oh, here we go. Thanks, Isaac.
Hi,
Hello.
hello. Can you hear me?
Yes.
Perfect. Thank you. Thank you, Dr. David Conn. My question is, so I know we briefly mentioned the effect that technological access can have on connection in community. And I'm wondering, since I work with older adults in helping them feel more comfortable using technology. And I was wondering what your thoughts were in terms of in what ways might the technology we have today that is being required to use in the world of today, how that might be able to either help or
Mm.
accelerate isolation and loneliness in older adults. And then as a follow-up, um, how might that look in the face of evolving technology, because technology is moving in one particular
Mm.
direction towards more automation. And I'm wondering what your thoughts were in terms of how that might either help or in your thoughts, how that might help or worsen uh, the idea of isolation and loneliness in older
Mm.
adults who are excluded in the field of technology. So thank you.
Right. That's a great question. Thanks, Isaac. And sounds like you're doing some really good work helping people to use technology. Because um, I think back to the pandemic, the COVID-19 pandemic, and how we were all pretty much isolated for several years, right? All over the world, we were so afraid of becoming ill, and so that I think spawned a massive increase in things like Zoom. Zoom existed before the pandemic, but I wish I'd invested in Zoom at the time, right? Because the value of this company must have gone up dramatically, um, and for good reasons. And I think the kind of connection we were able to have with friends and family during the pandemic electronically through Zoom or equivalents was really, really important. And I think it really helped us to get through. we still felt somewhat isolated, and many of us felt lonely as well during that time. But the technology was a real boost and it really helped us. And it continues to, I think, to help us stay connected. Now, older adults, for various reasons, may be great at using technology or not so great. And it varies, obviously. And I think as older adults, and I'll include myself here, we've all gotten better, much better at getting comfortable. And whether it's just with a cell phone or whether it's using a platform like this. But there are some older people who were never really interested in this kind of technology, were afraid of it, and who never really adopted it. And so they can still be trained. And there are all sorts of programs now that, help older people to learn the basics. And that can be very valuable. Those kind of programs in community centers are actually very, very popular. I think that there are other challenges, though. For example, as we age, we're more likely to have cognitive difficulties, to have memory problems, and along with that, if we have a significant cognitive issue or even say early dementia, it becomes much more difficult to learn, and it becomes much more difficult to actually navigate the complexities, of our technology. And so those people need help. It doesn't mean they can't use it, but it becomes a bit more difficult. So I think for us, again, it's recognizing that there's a huge range among older adults in terms of how tech savvy that we are, and but I think we have to do our best to help people. The other thing is, I think and there are some companies who now try to simplify our tools and make it easier to use technology, easier, let's say, for older adults who might be having some cognitive issues. And I think that can be really, really valuable as well. So I think Isaac's question also, though, was saying, well, okay, as we get more and more immersed in these technologies and in AI, which is everyone's talking about AI these days and how that's going to change us. I think we're still at the very early phases of that, and it is a bit scary. The dramatic automation that occurs with AI and the again reduction in connection with the live individuals. Everything now becomes machine focused, and it's scary. It is a scary world. So I think we have to work doubly hard to maximize human interactions, and while recognizing that there's a relentless development of technology that none of us can stop.
Very fair point. Well, thank you for that, Dr. Conn. Hopefully that covered what you were inquiring about as well, Isaac. A few more questions in the chat here. We have Jim Ellis who has a question. Jim, if you're here and want to ask it, please raise your hand. Otherwise, I will go ahead and ask it myself. But Jim is here asking, knowing this demographic, how do we get them to reach out and ask for help with isolation and loneliness?
And can you just repeat the first part?
Yeah. So Jim just says, knowing this demographic,
Yeah.
how do we get them to reach out and ask for help with isolation and loneliness?
Yeah, I think so. One thing that we emphasize actually in these clinical guidelines is education and how all of us need to communicate how significant an issue this is. And I think we're all at this point aware that physical exercise is a really good thing. And you'll see it every day in the media, in medical papers, that it's dramatic evidence, right? That the more active we are, the better it is for our health, both physical health and mental health, and it's really extraordinary. But how many of us actually get enough exercise? And how many of us are getting in our 10,000 steps a day? Recognizing again that older people sometimes have limitations on how much they can move or challenges. But for all of us, I think we're sold on the fact that physical exercise is a good thing. Whether we adhere to that and do our best or not, that's a complex question. But I don't think we're all as aware that social connection is just as important. And as I mentioned earlier, has some of the same kind of negative outcomes. So just first of all, educating people, this is really important. Um, and then finding out, as I keep going back to this idea that everyone is different, that we're all individuals with different perspectives. And I did want to mention that because I think it's really, really important. So, because there are some people who just seem to say, well, the solution is all you got to do is just connect with more people and then everything's fine. And I think that's too simplistic because we are all different. There are some of us who need a lot of connection. You know, the extroverted person. They love human connection. They love talking. It's what they live for. And then there are those of us who are quieter, a little bit more introverted. And introverts, by and large, don't need as much, right? They're quite happy with maybe smaller, briefer conversations with a smaller group of people. That's fine. I think we should recognize that there's this huge continuum of to what people need. And another thing that's worth noting is the question of solitude on the flip side. So I'm going to show, I can see quite a few people. How many of you actually like spending a bit of time alone? That you find it a nice, pleasant thing to do? Right, almost everyone's putting up their hand, right? So I think, and there's quite a bit of research actually into the benefits of solitude, that if you spend time alone, you can get into a different mind state and a more relaxed state perhaps, and even a more creative state. So solitude, like a walk in the forest alone, that can be a beautiful thing. We shouldn't simplify it too much. So I think that we should say that it's finding the right balance, and the balance is different for different people. But for those people who are truly lonely and isolated, then I think it's true to say that that we should help them to become more connected. And there are many different ways of doing that. I'll give you one simple example, okay? And I love this example because it's in our guidelines, and that is having a pet, or what's called animal-assisted therapy, which is more significant. Having a pet, a dog, for example, can allow you and encourage you to have way more social connections, because if you walk your dog in the community, all sorts of people are going to come up to you and want to pat your dog.
Yeah.
And then once they start patting your dog, you have a little chat with them. It's brief, but it's meaningful. And so in the Netherlands, which is one of the countries in the world that has a national campaign to end loneliness, they established a program. It's really clever. They said there's all sorts of older people who don't really have the energy or the resource to have their own dog. And then there's all sorts of younger people who are working all day long and they don't even have enough time to walk their dog. So what they did is they created an app, and it allows connections to form between an older person who would love to walk a dog to a younger person who has a dog and doesn't have enough time. Okay.
Oh, smart. Yeah.
And the older person actually becomes kind of a sort of co-owner of the dog, if you like, but they're not fully responsible for it. They don't have to pay the vet bills and so on. And this is now a national program in the Netherlands. And I saw an article a while ago that said, you know, they had made 4,000 successful pairings.
Wow.
Using this idea. So it's a simple idea, very creative, innovative, and has very positive results.
Yeah, that's fascinating. Tons of activity again in the chat here, so I'll reach out to some questions here. And I do also want us to loop back to the guidelines that are in place. So that does connect a bit to Caitlin's question here, who asks, Dr. Conn, are you able to speak to the concept of intergenerational connections in programs? Are there published best practices or guidelines for such concept or research that speaks to its benefit? So maybe if you can touch on that as well as the guidelines overall.
Yeah, that's a great question. Thank you for that. And I think so intergenerational. So that means, connecting people of different age groups. So a classic example of that might be um, where a group of school kids visit a long-term care home on a regular basis and visit the residents of the long-term care home. And maybe they bring music with them and a choir, and then they have time to mingle. Or it could be older people perhaps volunteering in schools to help kids learn to read. Those intergenerational programs can be very, very successful. And I think, look, as we age, we love spending time, most of us love spending time with young kids if we have that opportunity. If you're blessed with having grandchildren, I'm fortunate. I have 4 little ones. I'm very lucky. But it's a beautiful thing. So I think it brings an incredible energy in life as we age to spend time with younger people. So I agree that intergenerational programming, if that can be established in any way, I think it can be incredibly helpful. So there's all sorts of ways that older people can be connected. So I mentioned volunteering there, I mean, just, if you're retired and you still have some energy and opportunity to volunteer in your community, that can be just a beautiful thing and a very positive thing.
Thank you. Thank you for that. We also have some questions in the chat here regarding demographics and social isolation. So we have some folks asking about rural versus urban location and the impact of that. And as well, I guess we do just a broader question of if there are demographic, gender, race, age even sort of demographic factors that lead to social isolation and loneliness.
Right. So thank you for that. There's a long list of risk factors. We call them risk factors, which means, if you're in this particular category, then you're more likely to become isolated and lonely. So age is a factor, although the data is actually very interesting. So recent Canadian data, for example, found that if you take a look at older people, it's actually the younger, older people that report more loneliness than the people over the age of 80, which is a bit of a surprise. But it may be because people who are over 80 are more likely to be in a setting with other people. Male versus female is actually interesting as well. By and large, women do report somewhat a higher rate of loneliness later in life, but then older women are more likely to be living alone because they're more likely to have lost their spouse or partner because women live longer than men. So, but both men and women report high degrees of loneliness.
Okay.
For any minority group, particularly disadvantaged minority groups, are more likely to report isolation and loneliness. LGBTQ, for example, obviously, if you're going through major life transitions and if you've unfortunately, lost your spouse, obviously that's a extreme risk factor. Rural versus urban is not that clear. You would, I'm not sure what you would think. If you think that living in a rural community, you might think you're more likely to be lonely because of the geography.
Right.
But smaller communities are more connected as compared to the kind of anonymity in a large urban center. So the data on that is not that clear. I think those are some of the things that come to mind around the demographics.
Okay. Thank you. And we have a question here from, excuse me, I think it's Eli _Ireland. If you are here and want to ask your question, it is fairly specific, but if you are here and want to ask it, feel free. Otherwise, I will read it aloud myself.
Thank you very much. Sorry,
Hey.
it's Eileen here from Dublin, Dr. Conn.
Hello.
I'm very familiar with Trinity. Thank you very much so far with all of your comments and conversation. I just have a specific when you're, you know, the FIRO-B tests for inventory, inclusion, control, and affection, for expressed and wanted behavior. Have you had any research on your tests that you're using and the interaction and intersection between that for somebody who has a low want to be included by others, and that how that then affects loneliness and social isolation? Is that a factor that comes into play when you're doing your research or analysis?
So are you saying, I didn't quite grasp what you were saying there. Is it to do with, you're saying it's just people who don't want to be?
That's right. The individual, the
Yeah.
behavioral, it's a behavior, the wanted and expressed behavior.
Yeah. I think, I mean, the desire for human connection, you would think is universal, but it does vary dramatically, and there is a huge continuum. And I think we have to accept that people are very different in that regard. But I think it's also good to understand the origins of why people feel a desire to be connected or not. There's actually been quite a lot written about early life attachment and whether people have a secure attachment with their parental figures and others in their life, or an insecure attachment. And that may well affect throughout our life how we feel our connections are to other people. So it's pretty complicated. And like I said earlier, for some people, psychotherapy can be helpful. Of course, the person has to be motivated and has to want to change in some way, has to want to understand themselves. So, but I think we have to just accept the fact that people are dramatically different in that regard.
Okay,
Thank
thank
you.
you.
Thanks. And we have a question here from Ken Howe. Ken, if you want to read it, please feel free.
Yes, hello, and thank you for this discussion. Wonderful, wonderful. We've been trying to figure out what's the best model of housing for seniors, because so often, you know, we realized in our community there was a shortage of housing, and then it was going to be general. Then we realized that the seniors suffered the worst. And I think maybe, you know, we talk about teens being the greatest group that are unhoused or you know, on the street, but I think seniors probably are the largest. We were embarrassed to say that we're couch surfing, and those that do go on the street as seniors don't live very long.
Yeah.
So we've come up with the idea that probably co-housing is the best model of housing, where people are living in community and building small units that are then almost force the dwelling people to live outside and in community. Have you done any research on that sort of thing?
Not personally, but I think there are many different models of housing that have emerged over the years in terms of for older adults. You mentioned, of course, people who might become homeless, and the majority of those have mental health problems, substance use problems, and so on. That's in all of our big cities, that has become an increasing problem and very sad problem. But, you know, it's so interesting. A lot of older people do live separately in apartments or even in their own single dwellings, right? And people cling to that. Everyone seems to want to live in, you know, separately. And yet, many of us talk about, as we age, maybe we should live in communes. Maybe we should actually live together and share resources. And then recognizing the fact that as we age, we're going to need help. Many of us are going to need caregivers, you know, support workers, people who are going to help us survive. And that's costly, but you know, if you live together, maybe we could share the cost. So I find that we were having these discussions with my with our friends recently. You know, maybe that's a good model. And of course, a lot of older people then move into retirement home settings, either communities or buildings, where you have greater social connections and social opportunities if you want to take them. So I think that's one of the advantages of, say, moving into a retirement home would be that most retirement homes have activities and programs, and you have communal meals. So in terms of this particular issue of social isolation and loneliness, it can be a really positive thing as opposed to, staying in your own apartment separately or in a house out somewhere out in the community. So I agree with you that we should look at optimal models and the cost, and really consider what's right for each of us. So
Yeah,
thank you.
the funny thing is, I think we've forgotten that most of the people on this connection probably were more familiar with communes in the 60s.
Yeah.
If you're 60, 70, 80 years old, you're familiar with that model of living
That's right.
together. And it's weird that during that period of time, masses of schools were built because a lot of children were being born post Second World War, and now those schools are vacant, and that's what we have done. We purchased and had offers of a multitude of other school buildings to, well, will you take this one? Will you fix this one up? No, it's hard enough to do one, never mind to do multiples. But the school model is just perfect for converting into co-housing all on one
Right.
level. Thank you
Thanks,
very
Ken.
much for your
Thank
study,
you.
and I'll look forward to reading more of your stuff.
Thank you, Ken. Lots of conversation about accessing populations of older adults, specifically through the use of transportation and the impact that transportation and public structures have on accessing older adults. Joel here also asks, isolated seniors are somewhat invisible and hard to identify and find. Are there successful models of systematic outreach to identify those who are isolated and link them with a system of intervention?
Mhm. Right. So there were kind of two comments or questions there. I think one was about transportation and how critical that is, and that's for sure. I mean, if we're going to be with each other, we have to be able to travel, and that's a real issue for some older people who have mobility issues. So communities have to do their best to provide public transportation, including for those individuals who are compromised. Maybe wheelchairs are required for transportation. So I think that's really critical. And there's the whole concept, of course, of senior-friendly cities and towns and communities, and transportation and movement is very critical, and being able to do that in an optimal fashion. So I agree that's something that we need to put increasing resources into. Then the second question, I think, was about outreach. How do we actually reach the people who are truly alone? And I think that you're hitting the nail on the head there, because it's the people, those are the people who are probably suffering the most, or maybe, and they're the hardest to reach. And so I think that's where smaller communities perhaps have an advantage, and you can have programs where everyone is made aware of the fact that this is a problem, and that as a community we have to identify people who are truly isolated and alone and who need extra supports. And so I think that's something that we haven't really dealt with very effectively, and we need really better models of how to identify those individuals and reach out to them. I mean, I think yeah, do you have any thoughts or ideas about that, about how we could do better?
Myself or the audience members?
Well, the person who asked the question, actually, I was wondering. Yeah.
Yeah, let me just pull up and check and see who asked that question in particular. Yes, it was Joel. So Joel, if you are here and have any input, we welcome you to raise your hand.
Oh, it's my dear friend and colleague.
Hi, David.
Hi, Joel.
It's a great conversation, and thank you for doing it. There was I asked it partly out of some personal experience with being engaged in a project in Canada, but it's quite a complex interplay, I think, of identifying a number of factors, but I think direct outreach to seniors where they live is one thing. Public housing, for example. Another is that there are we kind of assume, certainly in many countries, that that seniors are connected in the medical system, let's say, or whatever. But there is a substantial subset of seniors who actually are not well connected or connected at all in the medical system. But they do link with social service agencies, with there are outreach things that do reach them. So engaging those organizations and agencies that have direct contact with people and linking them with one another with some kind of plan in a community to respond to what they identify, I think can be effective. But I think that the key to this in many ways is reaching out as opposed to providing reactive services. Because I think many people are ashamed of loneliness. They don't feel that they have a right to much. They don't have much knowledge of what's available. Their technology skills are not very good often, and so forth.
Yeah, I think your point about
those are some thoughts.
Yeah, thanks, Joel. I think the point about people being ashamed or unwilling to share that, I think is really important. And there's a stigma, of course, with all mental health problems, but there's a real stigma around admitting that you feel lonely, I think. And we did a survey when we were creating the guidelines. We did a survey of about 2,000 Canadian seniors and asked them about their ideas and attitudes related to loneliness and isolation. And one of the things that was quite striking is the vast majority said they would never bring it up with their family doctor. They didn't think the family doctor would be that interested in it or would have the time to deal with it, and they'd be embarrassed to bring it up. And that was one of the sort of key learnings we got from this survey that was very helpful actually in then developing the guidelines, because I think you have to approach that question of are you lonely just very carefully in clinical practice.
Thank you, Dr. Conn. And again, so many great inputs in the chat here as well. And unfortunately, we are coming to a close of our meeting today.
Can we record the chat? Do you record it or keep a?
Yes, we have a record.
I'd love to get a copy of that if it's possible.
For sure. Yes, of course. And perhaps also encourage any other audience members who have continued questions that David Conn is available to reach if necessary for continuing the conversation.
I can put my email, and I don't mind if anyone wants to connect with me. That would be just fine. So
thank you so much. That's fantastic.
Put it in.
But before we wrap up, I would also love to hear your key takeaways from today's discussion. So we'll give you a moment to gather your thoughts just on what your key message would be for everybody. And in terms of our next week's speaker, we are still finalizing our speaker for next week. So please do keep an eye on your email inboxes for any additional updates about next week's speaker. And we anticipate sending an invitation out to everybody on Monday for that. So I will now pass it back to you, Dr. Conn. I see you've put your email in the chat there, so thank you for that. And take away last messages for anybody.
Yeah, well, first of all, I've really enjoyed today. It's been great to connect with all of you, perhaps not individually, but as a group. I think I think the main message is that social connection is critical, and that we have to, as a society, do better in the face of this sort of relentless technology that is taking over. That human connection, particularly in-person connection, I think is the very best for most of us. But also recognizing that as individuals, we're all different and have different needs when it comes to the optimal level of social connection. I think it's critical for us to reach out to those in the community that are isolated, and encourage people who find it difficult to just take small steps, just to do a little bit more, one step at a time, in the long run can actually make a big difference. It is an important health issue, and I think a lot of countries around the world are waking up to this. I should mention the UK, of course, that had this, has a minister for loneliness, and so has Japan now, and the national campaigns around the world to end loneliness, I think, are great. And I think Canada, we should have one too, because we don't currently. So.
Absolutely. Well, thank you so much for that, Dr. Conn, and thank you for being so generous with your time today. This was an incredible conversation, and I know that the audience members have gained a lot from this as well. So thank you so much for your time.
Well, thank you, and all of you at IFA. I really appreciate it, and thanks, Elizabeth.
Thank you. And before we sign off, I also would like to thank everybody for another great week of our Global Cafe, with dedicated thanks to the incredible people at the IFA who help us organize every week, especially Luana, who helps us out. So thank you very much. Everyone enjoy your weekend. Happy Friday. Take care and look forward to seeing you all next week. Bye-bye.